Welcome to Health Kingdom channel. Dietitians recommends these 5 foods to diabetes patients. People with diabetes have nearly double the risk of heart disease and are at a greater risk of developing mental health disorders such as depression. But most cases of type 2 diabetes are preventable and some can even be reversed. Taking steps to prevent or control diabetes doesn't mean living in deprivation, it means eating a tasty, balanced diet that will also boost your energy and improve your mood. You don't have to give up sweets entirely or resign yourself to a lifetime of bland food. Your food choices matter a lot when you've got diabetes. Some are better than others. Nothing is completely off limits. Even items that you might think of as the worst could be occasional treats, in tiny amounts. But they won't help you nutrition-wise, and it's easiest to manage your diabetes if you mainly stick to the best options. Avocados are low in carbohydrates, which means they have little effect on blood sugar levels. A recent study published in Nutritional Journal evaluated the effects of adding half an avocado to the standard lunch of healthy, overweight people. They discovered that avocados did not significantly impact blood sugar levels. Part of what makes avocados a good choice for people with diabetes is that, although they are low in carbs, they are high in fiber. Many other high-fiber foods may still spike blood sugar levels. Cucumber. According to a study published in the Journal of Plant Foods for Human Nutrition, type 2 diabetes patients could lower their blood sugar levels by eating cucumber. The nutritious vegetable could help diabetics as it contains high fiber content. Fiber is key to lowering blood sugar levels. It also helps slow down digestion of carbohydrates and sugar, which can further lower sugar levels. In fact, cucumbers contain an estimated 10 calories, as per the United States Department of Agriculture, USDA. The researchers reminded that the vegetable could help get the patients their fill without worrying about raising blood sugar too much. They are a crisp, cool, low-carb choice. Most importantly, keep in mind that cucumbers are not only for salads. You can also add thin slices to sandwiches or wraps and eat them as it is. Fresh or frozen berries. Although a source of carbohydrates, the high fiber content of berries makes them an excellent addition to a diabetic meal plan, of which approximately half the calories should come from carbohydrates. The best time of year to buy berries is during the summer because they are in season and you'll get the best price. But don't swear off berries throughout the rest of the year. Watch for sales on fresh or frozen berries. Berries can make a diabetic dinner salad a little more interesting and satisfying. Start with a 2-cup base of lettuce, greens and other low-carbohydrate vegetables like peppers, green beans, broccoli, carrots, celery, cucumber, mushrooms or tomatoes. Add 2 ounces of protein, like grilled chicken breast. Top with 3/4 cup of berries and 2 tablespoons of low-fat Italian dressing, 185 calories, 20 grams of carbohydrate, full-fat yogurt, and diabetes. The 2015 to 2020 Dietary Guidelines for Americans recommend yogurt as part of a healthful diet. Yogurt is a good source of protein, calcium, and vitamin D. Research also suggests that the probiotics, or beneficial bacteria, in yogurt may help to reduce inflammation. People who have type 2 diabetes tend to have high levels of inflammation in the body. Chronic inflammation can increase the risk of certain complications, such as heart disease and stroke. Oats. The glycemic index, GI, is a way to estimate how foods will raise the blood glucose. The higher the number, the higher the food raises blood glucose. Foods with lower GI scores are ideal for helping to keep blood sugar stable. These foods will typically not raise the blood glucose as far or as fast as high GI foods. Whole foods, such as oatmeal and muesli made from steel-cut or rolled oats, are low GI foods, with a score of under 55. In comparison, other breakfast cereals, such as puffed rice or corn flakes, have a GI score of above 70. Fiber's importance for diabetes patients. Fiber plays an important role in digestion, especially in someone with diabetes. Dietary fiber may help slow down the breakdown of sugars in the body. This may help prevent spikes in blood glucose and insulin levels. Eating fiber-rich foods like oatmeal throughout the day may make it easier for people with diabetes to keep their blood sugar stable. The American Diabetes Foundation notes that adults should eat at least 25 to 30 grams of fiber each day, but most adults do not even come close to a serving of oatmeal adds 8 grams of fiber to the diet, making it much easier to reach dietary recommendations. There are so many other foods I could list too, but these 5 are an amazing way to revamp your grocery list. Focus on minimizing added sugars and on not being afraid to add some quality sources of fat to your diet. Which items you can eat more? Number 1. Healthy fats from nuts, olive oil, fish oils, flax seeds, or avocados. Number 2. Fruits and vegetables, ideally fresh, the more colorful the better, whole fruit rather than juices. Number 3. High fiber cereals and breads made from whole grains. Number 4. Fish and shellfish, organic chicken or turkey. Number 5. High quality proteins such as eggs, beans, low fat dairy, and unsweetened yogurt. Which items you should eat less? Number 1. Trans fats from partially hydrogenated or deep fried foods. Number 2. Packaged and fast foods, especially those high in sugar, baked goods, sweets, chips, desserts. Number 3. White bread, sugary cereals, refined pastas or rice. Processed meat and red meat. Number 4. Low-fat products that have replaced fat with added sugar, such as fat-free yogurt. Thank you for watching this video. Please like, share and subscribe for getting more health tips.